For this video presentation, I'm going to talk to you about shoulder impingement. Then I'm going to teach you a very simple technique that you can apply to your patients and athletes to try to reduce some of the symptoms. In a nutshell, shoulder impingement is basically soft tissue structures are caught within the subacromial space. Typically, it's either the supraspinatus, the infraspinatus, the long end of the bicep, and also the subacromial bursa. The space of the acromion process and the greater tubercle is about 1 centimeter. Typically, if the acromion is flat, the space is increased, but it can be slightly curved or can be slightly hooked. Either way, something's going to get caught within. When a patient lifts their arm into abduction, so when they lift around 60 to 70 degrees to about 110, 120, they might catch the structures underneath here, and that's known as a painful arc. So what we're going to do is a taping system using 2 brands of tape. One is basically a microporous tape, and then this protects the skin from the application of a brown, which is a form of zinc oxide, and you can either call it a Leukotype P, but it's also called a tiger tan, and Physique have named it accordingly. So that's what we're going to use. Now, when we do this, I'm going to ask my patient to sit tall, which he is in this position here, and we're going to apply the micropore tape from the anterior part of the humerus around here, and then this is going to go towards the scapula, okay, so towards the medial border of the scapula. So that's roughly the measurement. So I'm going to take that cut in. Let's do that, like that. And then with this tape, you literally just pull it and it will peel. Okay, so you can peel the 2 bits of strip off, like so. And then what we're going to do is apply this around the anterior humerus. Excuse me, I'm on my back to you there, like that. There's no tension on his tape, and literally just have that coming down towards that medial border of the scapula here. Okay, and that would be fine. Make sure it's stuck. Sometimes you might have to use a pre-tape spray. You literally, especially if a person has been exercising, or you've been massaging with creams and oils, you have to clean it first, and you might just spray with a pre-tape, like a glue. Spray it, and then it's sticky, and then you can apply that to the skin using the tape. Okay, so using the brown zinc oxide type of tape, peel this back like so, and then what we're going to ask the patient to do is, can you externally rotate and maintain that position? Apply the brown over the white so there's no contact to the skin directly. Take the measurement of the tape, which would be about here, but try not to go over the skin. If you can rip it, it's great. If not, use the scissors. And then from there, I'm just going to put a bit of pre-tension on the tape, and you can see the white tape puckering, like so. So the brown tape is in contact with the white, and you can see it does not go onto the skin directly. Let the person just relax there. Just stick these ends down. Now what happens now is, you could leave this on for maybe 2 or 3 or 4 days, and when you do remove it, I would suggest you use soap and water just to wet it, and then you can just peel it off. When the patient starts to lift their arm now, so if he goes into abduction, just slowly lift your arm up, they'll feel the tension of the tape, and what it does, if he knows he's going to get pain, the tape will almost control the external rotation, because you'd want to rotate, so the greater tubercle is rotating away from the acromion process. And that simple technique can assist in reducing some of the symptoms, especially in motion, as we are abducting. Okay, so just bear that in mind. Using the 2 bits of tape, so either the Leukotype P or Tiger Tan, and then the micropore, and you can buy these in a pack. I hope you've enjoyed the video, and thank you for watching.